I'm a physician training to be a urologist, and I finished high school, college, and medical school, and now I'm in specialty training for urology. There's a lot of different specialties such as orthopedic surgery, internal medicine, emergency medicine, pediatrics, and I specialize in surgery, in specifically urology. It's 5 years of clinical training and 1 year of research in our program, so I'm fifth out of 6 years. And then I'm currently applying for a fellowship, which is one additional year in reconstructive urology. So my job entails mostly assisting with surgeries in clinic and taking care of the patients who already had surgery for urologic problems. So there's a variety of urologic issues such as stones, cancer of the kidneys, bladder, prostate. There's also reconstructive issues such as what your project more deals with for both transgender and non-transgender people, both men and women. So it's a diverse field.
Yeah.
But it's very hands-on, and it's for people with problems of the urinary tract that involve surgical repairs.
Okay.
All right. And could you tell us why you chose to get into medicine and why you specifically chose to get into urology?
Yeah, so I had a lot of members of my family in the medical field. My dad's a family doctor. I have cardiologists, gynecologists in my family. I went to medical school thinking I wanted to help people. I wanted a hands-on career. I always had an aptitude for science and math, and it really seemed like a good field to make an impact and have a career that was fulfilling. When I went to medical school, I didn't know I wanted to be a urologist or even a surgeon, but I found that it was by far the most interesting to me, and urology was a nice balance of surgery and medical treatment, along with a lot of problems I found interesting naturally. And urology is actually, though it may not seem like it's filled with problems that are fixable, whereas a lot of other surgical fields, people have problems that are difficult to fix. It was also just somehow seemed to be a natural fit talking to patients about sensitive issues that they didn't necessarily want to talk to everyone about.
Oh, that's
okay.
cool. And so, have you worked with a lot of transgender people?
Yeah. At the University of Chicago, we're a big center for female-to-male transgender people, and not so many male-to-female, though I have encountered a few. But I've had more experience with female-to-male, and I'd say probably between 10 and 15 patients, some multiple times. So yes, I've had a reasonably large experience working with those patients.
Okay.
All right. And could you tell us what it's like to work with those patients?
So one thing, the patients are very different from each other. A lot of people think, a female wants to be a male, they're all the same. But in reality, there's a large, just like any 10 men are different, or any 10 women are different, or any 10 gay men are different. The same goes for transgender female-to-male patients. So some are, they each have their own quirks, and they each have different expectations and different wants and needs. And the key is to provide personalized care, try to understand where the patient's coming from, and try to do your best to help them out as much as you can.
Okay.
And so, do you know much about, gender reassignment surgery and how it works?
I know a reasonable amount. I know more about female to male just because that's what I've encountered, but I know a reasonable amount about both, yes.
Yeah, could you tell us about the procedure a little bit?
So, for female to male, there's multiple different procedures. There's less invasive and complicated procedures, and there's more invasive, complicated procedures. The gold standard, kind of the best outcomes, though the most complicated procedure is called a free flap. And what that involves is taking a piece, usually a patient's arm, and basically fashioning it to look like a male genitalia, and then kind of doing a transplant from the same patient and moving it down to the genital region.
Okay.
And that uses like a microscope to hook up the nerves, arteries, and veins.
Okay.
There's less invasive procedures where it involves just kind of sculpting tissue down there to try to add length to female body parts.
Mhm.
Okay.
And so, like,
There's other, that's just that's kind of the final step in transition, like the private area. But there's also, females who become men, they also undergo a lot of other things like testosterone replacement, mastectomies to remove breast tissue, hysterectomy to remove a uterus, and sometimes facial plastic surgery to make their faces more feminine as well. And vice versa for men, there's procedures to, you can have estrogen replacement, you can have breast implants, you can have facial sculpting to soften facial features and make them more feminine. And there's gender reassignment surgery for women as well, which involves removing the penis and the vagina.
and so, like, do you find that for most of the patients who do receive these surgeries that they're they're satisfied with them and they're even happier after they have the surgeries?
The gender reassignment surgery is kind of the last step, and very few surgeons are willing to perform that surgery unless it's clear that the patient is living as the opposite sex for a prolonged period of years and have undergone multiple, hormone replacement and multiple other prior surgeries. So it's not taken very lightly. I've never encountered a patient who regretted having the gender reassignment surgery. Though gender reassignment surgery does involve a lot of complications, which I can go into if you'd like.
Yeah, that would be great.
So, for example, for women who become men, one of the issues is that while looking like a man is one desire, a lot of people would like to be able to stand at a urinal to pee instead of sitting down, and you would also be able to like to have sexual activity. So those things are not as easy as one would think. So, for example, when you transplant the arm down to the genital region, it doesn't get erect and it doesn't urinate or nothing. So keeping the tube open to the tip of the penis is difficult and can involve more surgeries to fix the urethra to keep it open. The other problem is getting it erect. So some people elect to have what's called a penile prosthesis placed, and that is not a benign surgery. It's relatively straightforward in a man who has erectile dysfunction, but in a transgender person, it's very complicated, and only a few centers in the world can place this.
Got it. And could you tell us a little bit about, you were talking about this a little bit, like the prerequisites before surgery, the letters of recommendation, I think there's like the real life check. So do you know the prerequisites for the surgery?
To have gender reassignment surgery?
Yeah.
I don't know for sure, as the urologists are not typically the ones who do that. It's usually the plastic surgeons. However, I do know that for anyone considering female to male surgery, they have to, first of all, live as a male for a prolonged period of years. And then the other thing is they have to be getting testosterone replacements. And then on top of that, they should have already had their breasts removed and other female organs removed, such as their ovaries and uterus and things like that. And only then, and I believe they also generally go to a psychologist to make sure that, there's no chance that they're going to have an issue after surgery. They regret it. So you make sure that it's for the patient's best interest and that they're sure about the decision. And then only after all those things do they undergo gender reassignment.
Okay.
All right.
And so, like, for our project, we're kind of examining, like, all of the parts to transgender persons transition. And so, like, one part that, like, a problem that a lot of people have, we found out, was, like, with healthcare. So, like, do you know what kind of issues, like, could you, like, tell us a little bit about healthcare issues that they usually have?
So first of all, as I said, the surgery's pretty complicated. There's only a few centers around the country.
Mm-hmm.
There's a few centers around the world that do these types of surgery. So that's one issue. So I would say access to high-level appropriate health care is a problem.
Mm-hmm.
For example, if you live in Chicago, there's probably two places you can go in the city.
Yeah.
But let's say you live a few hours away. Whether you can come to Chicago or, you can get on a plane. But if you live in the middle of Idaho or Wyoming or North Dakota or South Dakota, you really can't go anywhere in your state for medical care other than very routine things, but really nothing in terms of gender reassignment.
Okay.
Other issues involve discrimination. We're just at that point in society where gender issues, probably for a similar reason why you're focusing on them, others are starting to focus on the issues that transgender people face. It's always interesting to me to see the patients come to the preoperative area or a clinic, and I'll tell you, the vast majority of them, you would never know that they're transgendered, and they walk through the hospital and they walk through life with no one even knowing that they weren't born in that gender. So while you may or I may think that, it's so obvious that they're transgendered, it's not so obvious for the vast majority of them until they tell you their story.
Mm-hmm.
Other issues just involve, they're a lot. The surgeries aren't perfect, and they're taking, for example, if a woman becomes a man, they're taking a fully functional female body.
Mm-hmm.
And they're trying to become a man, and so they take someone who really has no medical problems, especially because many of these people are 20 or 30 years old when they're undergoing transition, and then they embark on a journey that has a lot of medical issues. So I think all those things combined mean that these people end up having a lot of medical problems at a relatively young age with there are relatively few centers that specialize in their needs.
Mm-hmm.
Not to mention the discriminatory issues.
Yeah.
Yeah. And you were talking a little bit about this, but so a lot of people that come to the university, the hospital, they have already had a lot of the plastic surgery before getting gender reassignment surgery. It's kind of the final step, correct?
Yes.
Okay. All right.
As you may recognize, there's a handful of centers that specialize in surgery, and so the patients tend to go between those few centers, seeking out the best medical care. And these patients are young and active, and they don't want to travel across the country. So we've had patients who live in New York and get some surgery there, and then they're actually from Chicago, so they end up coming back to us for some surgeries, and we're happy to treat anyone who is in need of a surgery that we provide.
Oh, okay.
As with anyone, most people in life don't stay at one center for all of their medical care.
Yeah. So for our project, we also have a question that's kind of guiding us throughout our research, and that we have to answer at the end of it.
Okay.
So if you could just kind of give us your answer to it. So is a medical operation either by surgery or hormones enough to define someone's gender?
I'm sorry, what?
Okay. Is a medical operation either by surgery or hormones enough to define someone's gender? So it's kind of...
Personally, I think that people are born a certain the physical gender, and that internally they feel a certain innate gender. Some people call that a spiritual gender or a personal gender. For the vast majority of people in the world, those align, but for some people, they don't.
Yeah.
And so personally, I think that either in the combination of hormones or surgery, I think those only help people who don't, I think people who don't, those, like, you know, the innate gender and their physical gender don't align. I think hormones and surgery are tools for those patients to align those two.
Okay.
So I don't personally think hormones or gender define hormones or surgery define a gender for a patient. I think there's some people who, you know, for whatever reason, don't undergo hormones or surgery to define their gender, for societal or religious reasons or any other reasons. But so personally, I don't.
Okay, thank you.
And is there anything else you'd like us to know in particular, or any like certain experiences that you've had that you think would be helpful for us to know?
I think it's interesting to meet the patients and care for them. There's a wide variety of them. Some patients, you know, I've met patients who are very productive members of society.
Yeah.
I remember once, you know, a male transgender person. He's a fireman. He's married with adoptive kids, and he's extremely masculine. And you would never know that he's transgendered, other than, you know, once he tells you, or you're doing surgery on him. On the other hand, there's people who are much more effeminate, who are living as men, who, you know, are struggling to find a partner. Some transgendered men feel like they're straight men who want to be with a woman, and some transgender men feel like they're gay men who want to be with men. So there's a big variety, and it's as you know, just like the homosexual population in America, just like the straight population in America. And so I think keeping an open mind to these people and just trying to be open-minded and treat them as human beings who are unique and fine however anyone comes. I'm glad that society is starting to recognize that, you know, transgender issues are real.
Yeah.
And, you know, transgender people have been around for hundreds and thousands of years. And, you know, just as homosexuals are pretty much open and you know, prejudice is becoming more and more not tolerated in our modern society towards homosexual people. I think the same is going on for transgender people these days, especially in certain areas, and I think that's a great thing. And I think if we look back, you know, 20 years from now, people will be thinking that, oh, we were prejudiced towards those people, and how silly that is. So I think the future will be more open-minded than currently.
All right.
Well,